Patients go to hospitals to get well. Unfortunately, more and more patients, visitors, and hospital staff have been picking up infections in hospitals.
Hospitals are more full, and we see sicker, older patients with the graying of America, and that puts us at risk for hospital-acquired infections.
Healthcare-associated infections, or HAIs, are now the most common complication of hospital care and one of the top 10 leading causes of death in the United States and key contributor to the rise in healthcare costs.
The Institute of Medicine has come out with a report that says as many as 100,000 people die of preventable errors in hospitals, and a lot of those are infections.
With reimbursements for infections declining, HAIs hurt not only patients and staff, but also a hospital's reputation and bottom line.
It adds tens of thousands of dollars to most hospital stays.
Traditional attempts to properly clean surfaces often fall short. Chemical products can be harmful to the environment, have been shown to actually induce antibiotic resistances, and may even contribute to the problem. High-touch surfaces such as keyboards and monitor controls are difficult to decontaminate without harming the electronics. Recent studies have demonstrated that environmental cleaning is often suboptimal in healthcare facilities. In one study of standardized environmental surfaces, only 48% were cleaned at terminal room cleaning standards.
And many of the pathogens that we worry about in the hospital are hardy bugs. They hang around on surfaces despite cleaning, especially the one that we're most concerned about in a lot of ways these days, Clostridium difficile, the cause of C. difficile colitis. It's a spore-forming organism, and spores are very hard to kill.
No matter how hard you clean it, you cannot get every crack, every crevice.
The Medical Center of Central Georgia has added a new important tool to its arsenal for controlling troublesome pathogens: Tru-D Rapid Room Disinfection. Tru-D is a remotely operated mobile system that uses natural ultraviolet light to disinfect surfaces. It is designed to break down the DNA of most bacteria, viruses, and spores, leaving them unable to reproduce. Tru-D doesn't require special installation or ventilation. You simply place the system near the center of the room. Move furnishings and objects away from the walls of any contaminated space. Step outside the room and activate it by a password-protected remote control. The system will adjust to the size, reflectivity, and content dynamics of the room to deliver cleansing ultraviolet light to accessible surfaces, even those in shadows.
You can dial it up or dial it down as needed, and I think the flexibility of that is one of the nice features of the system.
When the treatment is complete, Tru-D automatically shuts down and notifies the operator. Sensors monitor the process and report the results in real time. Advanced safety measures are even in place to immediately stop the process if the room is entered during treatment.
Disinfecting aborted.
Once the process is complete, the disinfected space is available for immediate patient use. Real-time readings provide hard evidence that Tru-D delivers the right level of treatment to surfaces in both primary and secondary shadows. It provides reassurance that the room is ready for patients and staff. Tru-D is designed to help staff provide faster turnover of what has traditionally been a very labor-intensive process. The system is automated. It remotely targets contaminated surfaces at the flip of a switch. It's quick to learn, easy to use.
It's very user-friendly. It's easy to train people.
Tru-D offers the Medical Center of Central Georgia a novel, automated, and efficient environmental disinfection tool for reducing pathogens on commonly touched hospital surfaces.
I think using technologies like this, like Tru-D, in a proactive, preventative manner is probably important because an ounce of prevention is worth a pound of cure. I'm quite pleased so far.
It provides you with a level of comfort and assurance that problem areas in hospitals such as operating suites or cath and EP labs are being disinfected very thoroughly.
There's going to be more and more reporting of hospital-acquired infections, and that anything we can do to keep that number as low as we can, it helps outcomes, it helps patient safety, it helps the way we are perceived, and it's just good patient care, and it's good for business. It's a win-win-win situation when you can do that.